Welcome to Omni Academy. This is Maria, and today we are starting our 12th lecture on the development of eye. In the last lecture, we studied the congenital anomalies of eye, and in today's lecture, we will be discussing a clinical scenario. So, let's start our today's lecture. So, the scenario is you examined a child of 3 years age and found a keyhole pupil right sided. So first question is that what would this condition be called? The answer for it is that it is called Coloboma Iris. As in the scenario, it is mentioned that the patient has a keyhole pupil, and we know that keyhole pupil is a characteristic feature found among patients with iris coloboma. So now let's move to the second question, which is give the embryological basis for this disease. So as we know that during the 6th week of development, the optic cup exhibits a groove on its inferior surface, which we know that is known as choroid fissure. So the fissure normally closes to encapsulate the hyaloid vessels and complete the spherical structure of the eye. But a coloboma occurs due to failure of complete closure of the choroid fissure, leaving a defect or cleft or gap in the iris tissue that presents as a characteristic keyhole appearance. So now let's move to the third question, which is write a note on the development of fibrous coat of eyeball. So the fibrous coat of the eyeball is actually the outer layer of the eyeball, which is the fibrous layer of the eyeball, as I mentioned in the first lecture. So the fibrous layer of the eyeball is made up of the sclera and the cornea. And the development of sclera and cornea we have discussed in our previous lectures. So for the development of sclera and cornea, you have to watch our lectures which are available on YouTube on the development of sclera and cornea. So let's now discuss the causes of this disease. So there are three factors that are responsible for causing iris coloboma, and these factors are number one, genetic factors, number two, environmental factors, and number three, it is multifactorial or it may have idiopathic causes. So let's start with the genetic factors. So there are three genetic factors. So the first factor among the genetic factor is the hereditary or familial inheritance, which means that the patient can inherit this disease from their parents. Most isolated colobomas are inherited as an autosomal dominant trait. If a parent carries the mutated gene, there is a 50% chance of passing it on to their offspring, though the severity can vary significantly between family members. So let's now discuss the second factor among the genetic factor, which is chromosomal abnormalities. Coloboma can occur as a part of multi-system genetic syndromes resulting from chromosomal deletions or duplications, such as Cari syndrome or TOS syndrome. So now let's move to the third factor among the genetic factor, which is specific gene mutations. Mutations in regulatory genes that are regulating early eye development, mostly the PAX6 gene, PAX2 gene, and the sonic hedgehog signaling proteins, can disrupt the precise signaling required for the choroid fissure to close cleanly. So these are the three genetic factors that are responsible for causing iris coloboma. So let's now move to the environmental factors. Exposure to harmful agents during critical windows of ocular morphogenesis, which is especially between the 4th and 6th weeks of gestation, can disrupt the closure of the fissure. So there are three environmental factors that are responsible for causing iris coloboma. The first factor is the maternal infection. Intrauterine infections such as cytomegalovirus and toxoplasmosis during early pregnancy can interfere with tissue fusion. Second factor among the environmental factor is fetal alcohol syndrome. Maternal alcohol consumption during early embryonic development is a well-documented teratogenic cause of ocular defects, including colobomas. So now let's discuss the third factor among the environmental factor, which is medication exposure. Gestational exposure to certain prescription drugs such as thalidomide or certain systemic retinoids such as vitamin A derivatives can severely disrupt neural crest cell migration and fusion of choroid fissure. So these are the three environmental factors, or you can say teratogens, that are responsible for causing iris coloboma. So let's now move to the third factor, which is responsible for causing iris coloboma. In many sporadic clinical cases where there is no family history or non-teratogenic exposure, the condition is considered multifactorial. This means it arises from an unpredictable interaction between minor subclinical environmental triggers and an underlying genetic susceptibility during embryonic development. So these are the factors that are responsible for causing iris coloboma. So now let's move to our next question. So the next question is the effects of this condition on vision. So let's now discuss the effects of iris coloboma on the vision. The first effect is the photophobia and the second effect is the blurry vision. So the photophobia means that the patients of iris coloboma are sensitive to light because a segment of the iris is completely missing and the pupil cannot contract fully. This permits excessive unregulated light to enter the eye, causing glare and discomfort in bright conditions. The second effect is blurry vision or refractive errors. The structural gap can cause irregular scattering of light on the lens and retina, leading to mild blurring or distortion in the vision. So this was our today's lecture. In the next lecture, we will be studying the development of tongue. So see you in the next lecture.